Hi, my name's Jackie Daniel. I'm the Chief Executive here at University Hospitals of Morecambe Bay. And welcome to my blog. So I've been in post just over 12 months now, and I thought it would be a really good opportunity to share with you some of the improvements that we've been making over that period and reflect a little bit in terms of what we've got lying ahead of us. It's really important that we do look back and that we reflect on matters that were in the past, and most of all learn the lessons that we have to learn as a result of it. But I want to put on record my thanks to the staff. We've got a huge, very dedicated workforce that have all been doing their bit to make the improvements. I'd like to also thank our partners that have been working with us to make those improvements, and the public and the patience of public have displayed really over the last 12 months whilst we've been fixing things and improving things. So thank you. I know from speaking with our patients, with our staff and governors, etc., that whilst everyone is naturally interested and indeed a little bit anxious, and I understand that as well, about the future of local services, what they also want to know about is what we're doing to fix the problems of the past. They want to know we're sorting things out and we're improving things as we go along. So when I joined the Trust a year ago, we were in the headlines for lots of the wrong reasons. We were in the headlines for delays with outpatients appointments. We had problems with our mortality rates, with record keeping, and our waiting times in accident and emergency departments were also way too long. We were also in the headlines for our maternity services, again for all the wrong reasons. So I want to take the opportunity just to update you on one or two of these things. I'd like to say something about outpatients, and to put things into scale, we book around 36,000 outpatient appointments every month. So it's really, really important that we get that right. And we've been looking at how we improve the patient experience, which is really through our kind of front of house, if you like, service in outpatients. So many people are coming through the door for their outpatient appointments. The first thing we did was enlist the Plain English campaign to look at our letters and make sure that they were free from jargon, they were really clear for people, people could understand just what they were required to do when they were coming for an appointment. But we've also looked on a specialty basis at creating what we call booking hubs, which is where the specialty teams own the booking of those appointments, where we make sure that we've got medical records, staff and nurses talking with doctors about the particular appointment, basically creating, if you like, a one-stop shop so that we get as good an experience for the patient as possible, and we get people talking to one another so that the patients don't see cracks, if you like, in the appointment system. We've also, as part of these improvements, launched our appointment reminder service. Now this facility is available in other walks of life, so in our banking systems and in almost every other area, but we're reminding patients of their appointment by text, also by phone. Patients can now choose to receive a telephone call, for example, confirming the date and the time of the next appointment, and they can cancel it if it's not convenient and rebook it. So this is a much more responsive way of delivering that service, and we're seeing early gains. We're seeing fewer missed appointments and overall better levels of satisfaction with what we're providing. It really isn't acceptable for records not to be available for an appointment, and we're driving up standards in this area. I think less than 100% case note availability is really not acceptable, and we'll keep on making improvements until we get to that level. What will really help with this, though, is that the Trust Board earlier in the year approved two important business cases to improve both record keeping and appointments. Firstly, we're in the process of moving a huge amount of our records off-site to a secure 24-hour Trust-managed facility. If you imagine, we can have a million records to store at any one time, and what we'll be doing with this new facility is actually using barcode technology to track all records in and out of the store, so that will really improve things. And also we've got work underway on what we call the Paper Light project, And in summary, this is about our clinicians, our doctors and nurses, having patient information on the computer screen at the time of the patient's appointment. So we're not relying on transporting bulky case notes across the system, across what is 5 hospital sites at the moment. Mortality rates have been in the headlines quite a lot recently and have prompted the KEO reviews in some hospitals. We've been doing a lot of work to make sure that our hospital death rate falls within an expected range. But we've been doing a lot of work to understand what drives our mortality rates and to make sure that we're doing all the right things to improve those. And in 2011, we were found to have one of the highest reported mortality rates nationally. And it's one of a number of indicators we and our partners look at to make sure that our death rates in hospital are within an expected range. And like all statistics, you know, they're not perfect, but I'm really pleased. For over a year now, reports show that our mortality rates are within those expected range for all areas, which is pleasing indeed, and a big improvement from 2011. This year has seen some really major improvements and some huge investments at Royal Lancaster Infirmary. We've invested around £5 million in actual fact in accident emergency department and in closing the old Nightingale wards and opening new medical wards for our patients. We've also opened dedicated minor injuries unit, and that means that patients can be seen separately from the main accident and emergency department. And we've created a new, what we call ambulatory care unit, and this actually allows patients to be directly referred from GPs. They don't need to sit in A&E and wait unduly. They can be taken straight onto the unit and receive treatment immediately. So I'm really pleased to report that a lot of hospitals are struggling with their A&E targets at the moment. We are seeing and treating people within our accident emergency departments within 4 hours as required to do so. And that's really where we want to continue to be. Maternity services have been in the spotlight quite rightly in recent years, and we've been doing a lot to improve our services, particularly over the last 12 months. We really welcome the impending independent review, which I think will look back over a decade of care and importantly make sure there are no further lessons that we need to learn. It was good to see and welcome Cathy Warwick, who is the Chief Executive of the Nursing and Midwifery Council recently. She came to hear firsthand from our midwives and our obstetricians and to talk with them about some of the improvements that we've made. And it was nice to see her comments on her blog when she said that she was really impressed by the dedication and the motivation among staff to achieving a really high quality of care for the women that use our maternity services. It wouldn't do justice, I don't think, in a blog like this to try and summarise all of the changes that have been underway in the last 12 months. So what I'd like to do is arrange for the team to produce a short video where they can talk about the changes they have made themselves. And I'll provide a link on my blog page to a report that I recently submitted to the board, which will give you a bit more information about changes across the trust, but in maternity services as well, over the last 12 months. What I can say is that we've definitely seen an improvement in the culture over that time. We've got teams working much more effectively together. I can see the evidence of that. And we've made a lot of investment as well in additional midwives and staff on the front line. And we've opened a special care baby unit at Furness General Hospital, allowing mums to be much closer to their baby whilst they receive care. So really pleased with that care environment. So how are we doing 1 year in? Well, I think things are significantly improved and will continue to improve as we move forward. We've now got a new trust board in place. I've got a full team of executives who are very capable, who will continue to work with me and with colleagues to make those further improvements we need to. Importantly though, the clinical directors, who are really at the heart of our decision making, are doing a fantastic job, and they make sure with me that patients are at the heart of everything that we do. We've built some very good, robust relationships with GPs and with our commissioners and other partners in the health system. And as you know, we're working to try and set out what the future plans for health services in Morecambe Bay are going to look like. And that work's progressing well. It's taking a little more time than we envisaged, but that's okay. If we get that right, it will really help us to further improve things. So I'll continue to keep you posted through these blogs. I hope that you find them informative. Please do give me some feedback. I'd like to know what you think and whether we're touching on the right areas. But for now, thank you very much.